Well, tonight, coronavirus cases and hospitalizations skyrocketing nationwide as we move into what some are calling a second wave. Across Alabama, more than 1,000 people are hospitalized.
It's raising the question, could a state of emergency similar to the one issued across state lines in Pensacola be issued here? NBC 15's Corey Pippen is live in Baldwin County tonight.
Corey, what do experts have to say about these concerns?
Well, Greg Kim, the head of the state's hospital association, says his main worry is what this increase in hospitalizations will do to staffing. And he says there are several reasons why a second wave of COVID could get much worse over the next few months.
We are in the upslope of that second wave. And it's actually fairly rapid.
Tonight, Dr. Don Williamson, executive director of Alabama's Hospital Association, is sounding the alarm on the startling coronavirus trend he's seeing statewide. An average of nearly 1,100 hospitalizations every day.
In mid-September, we were at about 720 to 730 hospitalizations. We are now seeing the explosion of new cases.
If things don't change, Dr. Williamson believes we're on our way toward matching the state's peak of around 1,600 daily hospitalizations from July into August.
The one thing that makes me think maybe it won't be is because probably the age of these patients are generally younger. They don't require as much hospitalization.
The problem, Dr. Williamson says, is the timing of this new wave, coming as families gather for the holidays and college students return home.
Some of them are going to be infected and bring COVID back home and not even be aware of it.
Making matters worse, Dr. Williamson says, is a lack of proper mask wearing. In Pensacola, a hospitalization spike prompted a state of emergency, raising concerns over bed space. In Mobile and Baldwin counties, infirmary health officials say they remain ready and capable to treat all patients. Spring Hill Medical Center's CEO says their challenge is a lack of ICU beds, and further increase in COVID hospitalizations could challenge capacity.
Hospitals around Alabama started this with a staffing shortage, and it's only being made worse because those COVID patients require more nursing assistance and often infect a healthcare worker.
Dr. Williamson says vaccines and therapies may be on the way, but most won't be available in mass supply until next year.
So if we could just avoid disease, probably through January, maybe through February, we could prevent some deaths, but I fear that we're going to turn that light at the end of the tunnel into an oncoming train.
Dr. Williamson says the state is also seeing around 10 to 15 influenza patients a day. An explosion in flu cases could make a dangerous situation much worse. Reporting live in Baldwin County tonight, I'm Corey Pippen, NBC 15 News.